Hi, welcome to this short presentation, which is an update for educators and all of those working with Year 2 medical students from Chester Medical School. I'm Nicola Connolly, I'm the Year 2 clinical lead, and if you've got any questions at all about any of the content or anything that's not covered, please don't hesitate to email me. So during the presentation, I'm going to recap a bit about the Year 2 curriculum for students currently on placement. I'll direct you to the Chester Educator Network, which is the external web page that has links to all the training videos from the educator training you did back in the summer last year before the start of the placements. And this website also has links to important policies to be aware of from the university and meetings and future educational events. I'm going to go through some key placement documents just to remind you and so you're aware of new documents since the previous educator training. We'll go over the raising a concern policy. I'll direct you to our spring conference, and then there's some final points for you as educators to be aware of. So, as you know, the University of Chester's contingency partner is Warwick Medical School, and this is a requirement by the GMC for all new schools to be paired with an existing school. And this means that our curriculum, learning outcomes and assessment are aligned with Warwick, and that gradually over time we will phase in our own assessments in terms of written papers and OSCEs. But for the current cohort, all of our written OSCE exams will be blueprinted from Warwick this year. As you know, it's a 4-year graduate entry programme, and students come from a range of backgrounds, including they can have a previous arts degree or a science degree, and they're a mix of both home and international students. As with other medical schools, the curriculum is underpinned by the GMC Outcomes for Graduates, and this document outlines the professional values, behaviours, skills and knowledge that we expect our students to have on completion of the degree. All of these outcomes for graduates can be found on the students' UMEP undergraduate medicine e-portfolio, and we encourage the students to map their experience to these outcomes over the course of their degree. The curriculum at Chester Medical School follows a spiral format with vertical themes embedded throughout each of the 4 years of the programme, which build in complexity as the students progress. And you can see the foundational science themes with the professional themes on top. So the teaching approaches at Chester Medical School include high fidelity, clinical skills and simulation. We have a number of simulated wards in the Wheeler building, including paediatric ward, obstetric ward, general wards, and also immersive simulation suite with VR facilities. We can teach the students clinical skills in-house to support what you're delivering in the hospitals. The applied anatomy teaching uses facilities including an anatomage table and also plastinet specimens. Teaching is delivered through different methods, including lectures, workshops, and follows case-based learning approach, which is the same as Warwick, using the majority same CBL cases as Warwick. This is supported by the students' online learning platform, Moodle, where they can also access e-learning and asynchronously delivered lectures. As someone involved in the education of students from Chester Medical School, it's really important that you're aware of our external website, the Chester Educator Network. And this has got lots of resources for you, including policies from the medical school, including how to raise a concern that I'll come on to shortly. And it's also got important placement documents, which I'll come on to shortly. It's got details of up and coming meetings as well, and contact details for different faculty staff. A couple of key documents for the year 2 are the handbook and the logbook. These documents aren't shared on the network, but can be accessed through your undergraduate medicine teams or contacting the university if you don't already have a copy. These documents both contain the learning outcomes for the clinical placements for second year at Chester Medical School. And the learning outcomes are broken down into medicine, surgery, and community and specialty presentations. The presentation lists provide the foundation for students to understand how to take histories for common presentations in these groups. And by the end of year 2, the expectations for students is that they're able to take a history, perform an examination, formulate an investigation and management plan for each of these presentations, and they can be tested on any of these. We also ask that the students are aware of some common differentials for each of these presentations, and in the handbook you can see there's a suggestion, for example, that students would know 3 differentials for each of these presentations, and they can be tested on any of this information in their written exams as well. And here are the learning outcomes for the community and specialty block. And you can see this includes paediatric, older adult, mental health, and obstetrics and gynecology in addition. What's outlined in the handbook is it's not just always on this placement that students will have exposure to these presentations. As you can appreciate, during their general practice block and during some of their simulated academic block sessions, they will also, for example, have exposure to teaching to meet these learning outcomes. For example, the students will undertake a simulated labour experience during their academic women's block. There is also a community and specialty logbook which helps support those supervisors supervising students on these placements at the Countess and Robert Jones. And you can see in this book it acts as a guide for students to be familiar with the presentations over the course of the year, and we encourage them to make a note in their logbook of things they've seen, majority of which will occur within the community and specialty block, but will occur as mentioned at other points in the year. It is not mandatory to physically or electronically sign this off for the students, but we do encourage you at the end of placement review to review any ongoing learning needs that the students have with regard to these presentations. On the community and specialty block, students will undertake lots of different experience to meet these learning outcomes, including specialist surgical experience, orthopaedics, paediatric clinics at both Robert Jones and the Countess of Chester, laboratory experience and investigations. Their community experience is novel to Chester and builds on the curriculum at Warwick, where students also undertake community experience, but we have incorporated more in terms of older adult experience on the frailty unit as the interface between hospital and the community, and also opportunity for students to see patients in different settings on home visits with the community healthy ageing team, hospital at home teams, and also with other community teams. There's also long-term condition days with teams such as pulmonary rehab and community health service teams, a sexual health clinic, substance misuse services, and as mentioned, community paediatric clinics. As educators and staff involved in organising placements, there's other key documents on the Chester Educator Network, which are the combined clinical and educational supervision guide and also guidance for year 2 clinical placements for local educator providers. The latter document has all of the information you need in terms of what assessments are required for the placements, what grade of doctor can sign off assessment, which assessment requirements are mandatory and which are recommended, and there's also detailed clinical skills guidance. Students have UMEP Access for Year 2, where we ask that they engage with the portfolio and log the assessments they undertake. As you know, for hospital placements, they need to do 1 OSLA, 1 mini-KECS and 1 CBD per placement, also 1 reflection and 1 end of placement sign-off. Students need to undertake these assessments in order to pass the year, and it's important they achieve these over the course of the year. They also have to take the same number of assessments in primary care setting, but of note, they don't undertake workplace-based assessments when they're on their surgical block GP placements. The practical skills, teaching and procedural skills, as you can see, is front-loaded in the graduate entry programme, and the reason for this is that our aim is to teach all Year 2 students majority of their clinical skills to a minimum of simulation level by the end of Year 2. There's further guidance regarding this in that guidance for the LEPS document, which is on the Chester Educator Network, and you can see there are certain restrictions in place in terms of levels for which students can perform those skills in Year 2. For example, we don't allow students in Year 2 to perform an ABG on a real patient, but we do ask they perform that at simulated level. Students will then get those clinical skills signed off during sessions, which can be both in a combination of being taught on the campus and also on placement. And this clinical skills sign-off is tracked by university staff to ensure all students get appropriate sign-off by the end of the year. One of the most important things to make you aware of in this presentation is a reminder as to what you do if you have concerns about a student who's on placement with you or with a colleague. So again, the process for this can be found on the Chester Educator Network website. You can see there's some policy documents and there's the Raise a Concern policy. If you click on that link, you will then find the policy with a blue hyperlink, which will take you straight to a form where you can report your concerns to us. And this is for the internal process for dealing with lower level concerns about students on placement. But you can see on that policy if you have serious concerns, and if serious concerns fall outside of normal working hours, there is a 24-hour process for managing concerns that can be reported to the university through multiple channels. You can see there's a phone number there and there's a number of email addresses that are manned by university staff. And that would be, for example, if you had concerns about a student at 5:15 on a Friday afternoon that were serious and may involve safeguarding, for example. There are multiple other ways to report concerns. That can be done through a subclinical dean if you have one in post, through our undergraduate medicine teams, so the team at Chester Medical School through the email address, or through clinical leads directly, or the placement team at Chester Medical School, or you can phone us. So there's multiple ways to report concerns, but there is the policy on the network we want you to be aware of. And then if it's out of hours, there are the university processes in place, and you can find details for that through Chester Educator Network, or alternatively can be reported through the University of Chester Report a Concern website as well. And also just to mention educator training and development. So it's important we keep you up to date, and the next up and coming meetings for educators are all on that Chester Educator Network website. And there's also a training and development conference planned for March, and you can contact the medicine email address if you are able to come to this, and we will send you the link to register. Just as a reminder, assessments in Year 2, so there's a written exam and an OSCE exam, and they all fall within July, and we undertake professionalism assessment, which includes reviews of UMEP in June. And in terms of Year 3, so As you know, Dr. Sunil Nair is the clinical lead for Year 3 and Jamie Fanning for Year 4. And the Year 3 specialist placements will be starting in November after an initial academic block that the third year students will have in September. And this just shows you the current scheme for placements in third and fourth year. Fourth year is still slightly under revision, but you can see in the third year what happens is the students undergo specialist clinical placements, which are 5-week blocks, and those specialist clinical placements are obs and gynae, paediatrics, mental health, musculoskeletal, a medicine, a surgery, and emergency medicine placements. So final points for yourselves. Thank you so much for watching. Please ensure that your educator roles are recognised formally within your job plans. Please be aware of recent feedback that will have been shared with your trust from the first core clinical education block, which I fed back within the last month. What went well, what's been more challenging. In terms of general feedback, for all trusts, you were well organised, timetables were delivered, induction was done very well. In terms of challenges, it's been more around students being able to access educational supervisor time, which we appreciate can be challenging. So please see the feedback slides that I've sent on to each of the trusts for individual feedback. There were some challenges at the start of the year in terms of occupational health clearance for students. Please be reassured that this has now been rectified and there's a system in place to ensure students are cleared before they start placements. And we do have increased support for students now who have reasonable adjustment plans in place. We have a new equality, diversity, inclusion lead who works for the university, and an expanded placement team, including Kathy and Astrid, who are going to be working with you more closely to support you and the students on placement.